Okay, so almost everyone who loves coffee has probably felt it at some point, right? That little flutter, maybe your heart races a bit after maybe one cup too many.
Oh, absolutely. And, the media, well, they've run with that for years. We've all seen headlines linking coffee, caffeine specifically, to heart issues, especially arrhythmias.
Yeah, those scary headlines about your morning cup potentially causing rhythm problems. It
Yeah.
feels like a really common fear.
It really is. And that whole idea that coffee is inherently arrhythmogenic, that it causes arrhythmias, it's probably one of the most stubborn biomedical myths out there.
Hmm.
It's led to, potentially outdated advice, a lot of anxiety for patients. So our mission today really is to take a critical look at the latest evidence. We're diving into a big one, the decaf randomized clinical trial.
Okay.
And spoiler alert, it seriously challenges what we thought we knew about coffee in a condition called atrial fibrillation, or AFib.
Right, AFib. Let's give some context here. It's actually the most common heart rhythm disorder, isn't it?
It is, yeah. And the numbers are pretty striking. It's getting more common. And estimates suggest something like a third of people might develop it in their lifetime.
A third. Wow.
Yeah, and right now, over 10.5 million people in the U.S. alone are diagnosed. That's a huge number of people.
So for those millions, what was the usual advice regarding coffee?
Well, traditionally, doctors often advise patients to cut back or even completely stop drinking coffee and caffeine. The thinking was that it was a likely trigger for AFib episodes.
Okay, that makes sense based on the racing heart feeling.
Right, it seems intuitive. But the thing is, this advice was mostly based on, patient reports and maybe an abundance of caution, because even going back decades, the actual medical studies often struggle to show that coffee or tea caused or worsened arrhythmias.
Huh. So the evidence wasn't really there, even back then.
Not strongly, no. In fact, quite the opposite started appearing. Observational studies began popping up, suggesting maybe coffee drinkers had no extra risk or sometimes even a lower risk of AFib.
Lower risk. Interesting.
Yeah, and then there was the Sacrav randomized trial. That one found drinking caffeinated coffee didn't actually increase those early heartbeats, the ones known sometimes to kick off AFib. So the data was sort of leaning away from the old fear.
Okay, so that sets the stage perfectly for this new trial, the decaf randomized clinical trial. You said it was published just last month.
That's right, October 2025 in JAMA, a major journal. And this was designed to really nail down the question.
So how did they do it?
It was pretty straightforward, actually. They took 200 patients who already had an AFib diagnosis. Then, randomly, half were told to drink regular caffeinated coffee. The average was about 7 cups a week.
Okay, like a cup a day.
Exactly. And the other half, they had to abstain completely from coffee and all caffeine sources for 6 whole months.
Right, the direct comparison, what happened?
Well, this is where it gets really fascinating. The results were pretty much the opposite of the old wisdom. The rate of AFib coming back, the recurrence was significantly lower in the group drinking coffee.
Wait, lower. How much lower?
Okay, get this. In the coffee drinking group, the recurrence rate was 47%. In the group that stopped all caffeine, it was 64%.
Wow. So 64% for the abstainers, 47% for the coffee drinkers. That's quite a gap.
It's a huge gap. When you analyze it statistically, it means the coffee drinkers had about a 39% reduced risk or hazard of their AFib coming back compared to those who quit caffeine.
39% reduced risk from drinking coffee.
Precisely. This randomized data now strongly suggests coffee doesn't cause AFib episodes in these patients, and it might actually help reduce them. It's a major shift.
So for the listener trying to think critically here, what's the big takeaway? We have scary headlines, old advice telling millions to quit, and now this gold standard trial saying coffee might actually be protective.
Exactly. It highlights this tension, right, between population-level evidence and individual experience. The overall evidence now points quite strongly towards coffee being okay, maybe even beneficial for heart rhythm in general.
Oh, there's always a but, isn't there?
Right. There is. And it's crucial for critical thinking. The sources are very clear on this. While the average person or patient seems fine or better with coffee, if you personally drink coffee or tea and it makes you feel unwell, gives you palpitations, bad anxiety, whatever, then you should still listen to your body and stop.
Right. So the study is powerful, but it doesn't override your own direct experience.
Absolutely. It's about applying knowledge smartly. Respect the big data, but also respect your individual response. That's key.
That makes a lot of sense. It really underscores why we need to keep looking at the evidence, because science can, and often does, overturn things we thought were settled. So here's a final thought to maybe chew on. If this huge study suggests coffee isn't the trigger we feared, maybe. Maybe some of the perceived link in the past wasn't the caffeine itself, but actually the anxiety about drinking coffee. Anxiety fueled by decades of those negative messages.
That's actually a really interesting point. The nocebo effect, driven by fear.
Yeah.
Definitely something worth considering next time you reach for that morning cup.